So what is shockwave therapy? Shockwave therapy is a non-invasive treatment, and it's designed to stimulate the body's natural healing process by sending a high-frequency sound wave through the tissues. There's two types of shockwave therapy. There's radial shockwave therapy, which we have here in clinic, and you've got focused shockwave therapy. They do differ slightly, but for purposes of this video, I'm just going to talk about radial shockwave. Who is shockwave therapy for? Shockwave therapy primarily works on tendons. So in the cases we typically see in clinic, we work on the plantar fascia, the Achilles and patella tendinopathies, along with some tendon pathology you can get in the upper body as well. So your medial and lateral epicondylitis, your golfers and tennis elbow, and rotator cuff tendinopathies as well. Shockwave therapy works on chronic conditions. So we describe this as 3 months plus. So what you'll find is, if we take an Achilles, for example, the first sort of 6 weeks or so will be inflammatory, and then it comes out of that process, and what you'll find is the tendon's now in a degenerative state. We're using the shockwave to stimulate some fresh blood flow to the area, allow the body's natural healing process to take place. So what does a typical treatment plan look like involving shockwave therapy? Sessions are typically a week apart, and they're in either blocks of 3 or 6 sessions. 6 is the absolute maximum we do. There is a bit of a ceiling effect after you get past the 6th session, and 3 is a minimum. So during the treatment process, the shockwave will only take a couple of minutes, and alongside this, depending on the severity of the tendinopathy you've got, you'll be either asked to modify your training or potentially rest for the first just couple of weeks while the shockwave does its thing. So during a shockwave treatment plan, it won't just be shockwave therapy during the session. So your session will typically be a minimum of 30 minutes, but typically 45. And what we'll look to do is we'll address all the other factors that are overloading that tendon in the first place. So it may be a case of looking at your biomechanics, if it's something on the lower limb, so how the foot and ankle is moving and stressing certain tissues. And it may be looking at biomechanics of the upper thoracic and the shoulder region, if it's something more rotator cuff related. So we address this all within the session. We couple it with manual therapy as well. So if we're doing an Achilles, the shockwave will be focused on the Achilles, but there'll be manual therapy to maybe the foot and ankle, plantar fascia, calf, and further up the kinetic chain as well. So we're not just shockwaving the one area and sending you on your way. So typically for the first couple of sessions, depending on the severity of the pathology you've got, you may be asked to rest or modify your activity levels just to allow the shockwave to start to have an effect. And typically what you tend to find is after 1 or 2 sessions, your symptoms should start to improve straight away. Now in really chronic cases, sometimes it does take a little bit longer, or after the 6th session, you may not notice massive improvement straight away, but shockwave has its best response after about 8 to 12 weeks after the last shockwave. So if you're having a course of 6, that'll be 8 to 12 weeks after your 6th shockwave. So after the first few sessions, we'll start to introduce some strength and conditioning. So depending on the tendon that's involved, it might start with some isometrics to just load that tendon without taking it through a large stretch and shortening cycle. Or it may be some other work around some other joints that may be contributing to your symptoms. So what to expect during a session. So shockwave therapy during the session, so the couple of minutes when the shockwave's actually on, it can be uncomfortable, but what we like to stick with is around about a 6 out of 10 on a pain scale. Now what you'll find is if we're taking an Achilles, for example, and we're on the mid portion of the Achilles with a mid portion Achilles tendinopathy, is when it's on the area that needs it, it will be uncomfortable. You'll be talked through with your therapist and your physio as to what to expect and what pain levels are acceptable. But if you come above or below it on the tissues that's not got pathology in, it typically won't be painful at all. After the session, you may feel some discomfort, maybe into the next day, but after around 24 hours, your symptoms should have settled. So one important thing to note with your shockwave therapy is if we're doing it on a tendon that's injured, so let's take the Achilles again, for example, the shockwave needs to be placed on the area of most sensitivity. So if you take an Achilles, normally you're going to get more mid-portion Achilles tendinopathies than insertionals. So let's take a mid-portion. So when you're doing the shockwave therapy, I'm not going to turn the machine on because it's loud, but let's just say typically what you're going to find is the area of sensitivity or pain is going to be mid-portion. So all I'll do is I'll have a good palpate through the tendon, and I'm going to be asking Ewan in this case where his pain is. So if it's a mid-portion Achilles tendinopathy, normally he's going to say around about there. And it could be either side, it could be more medial, could be more lateral, could be right on top. But I've got my area that I know now needs the shockwave on it. So when I've found the area, all I'm going to do is I'm going to mark the area where the tendon is most sore. So as I start to come up, he's not really got much pain. And then his pain starts around here. Just going to mark those areas. Now it just gives me a really accurate area that I know that shockwave needs to be on. If you're having shockwave and this is where your pain is, and it's being used all around the heel and the foot and up the calf, it's just not getting to the true source of where we need it. So we found our area. All we need now is some gel, so ultrasound gel, that just transfers the sound waves through the tissues to start to have its effect. So we spread that out a little bit, we know our area, we've marked it, and now we can get started. So another important thing to note is whatever we're working on, so Achilles in this case, we just want to put the tendon on a bit of a stretch. So in this case, we'll just dorsiflex the ankle slightly. And while I'm doing the shockwave, I'm going to be asking my patient, Ewan in this case, what his pain scale's like. So I'm going to ask him and I'm going to try and get him to around about a 6 out of 10. And usually what we'll find is after 10 to 20 seconds on the specific area that you found that is sensitive and a 6 out of 10, just because the nerve endings are going to be desensitized, that will drop down maybe to a 3 or 4 out of 10. So all we're going to do is keep the shockwave in the same position, and we're just going to move it slightly, angle the head slightly, find another area that's sensitive, and we're going to aim for that 6 out of 10 again. And particularly in the case of an Achilles tendon as well, is because of its structure and where it is on the body, it's really easy to get around the whole structure. So make sure that we can go all the way from the medial side, we're going to come all the way around over the top of the tendon, and we'll come to the lateral side as well. So during that process, I'll be asking Ewan where the most sensitive areas are. I will stay there until he's got that desensitized effect again, and I'll keep working my way around that tendon until we've covered it all. So after I finish the shockwave, what I might then go in to do is I might treat the plantar fascia, I might do some mobilizations of the talocrural joint and subtalar joint, and I may do some soft tissue work up the calf as well, just to relieve some trigger points, contractures through there that are going to be affecting that Achilles tendon. So after the session, what you'll expect is a little bit of soreness just around the area that we've been working on, and that can usually last around about 24 hours. It shouldn't last much more than that. So shockwave therapy is pro-inflammatory. The aim is to stimulate the body's natural healing process and create some localized inflammation around the area you're treating. So it's important to note that during the treatment process, you stay away from ice application and you don't take any anti-inflammatories, whether that's tablet form or whether that's in the form of a cream like an ibuprofen gel.